I found the Arkansas Department of Health 2022 tobacco data deck. Um, Even though it says 2022, it gave results and statistics for 2020. So for Arkansas 2020, a higher percent of men smoked more than women. The percentage of smoking increased with age until around middle age and then decreased as Arkansans got older. So the tobacco data deck only shows data for white non Hispanic people and black non Hispanic people. But for these two groups, white non Hispanics had a higher percentage of current smokers compared to black non Hispanics. And the percentage of current smokers decreases as education level increases, and it also decreases as income level increases. So, from the American Lung Association, I found statistics for the US in 2022. And it sort of followed similar trends in the sense that men smoked more than women. Smoking increased with age until around middle age, then it dropped off. And then smoking rates decreases with an increase of education and an increase in income. The American Lung Association also included more races and ethnicities, and amongst all them, like white, black, American Indian slash Native slash Alaska Native, Asians, and Hispanic U.S. citizens, American Indians and Alaskan Natives had the highest smoking rates, and Asians had the lowest smoking rates. Okay. In general, Arkansas has a higher smoking rate than the U.S. So, ADH has the U.S. Uh, smoking rate at 15.5% and Arkansas at 20.5% in 2020. And the American Lung Association has the U.S. smoking rate at 11.6% and Arkansas at 18.7% in 2022. And from this, I can gather that we can probably should focus our resources on the groups that need it most, if that makes sense. Like focus on more on men with low income or lower education, and then focus on more middle aged people or the age group before middle age. Yeah. Why do I think cigarette smoking and tobacco related products remain a leading cause of morbidity and mortality in the U.S.? Family history, proximity, access. For example, if you're raised by a mother and father who both smoke, you're more likely going to smoke because you see people smoking frequently, so it becomes something normal to you. There would also be cigarettes in the house, so you have access to it. There's that. I think smoking is a sufficient cause of lung cancers. There are other things that can cause lung cancer, such as asbestos, air pollution, or just unfortunate genetics. I wouldn't say it's necessary for lung cancer, so I think it's just sufficient. And what is another exposure slash disease outcome that I see in public health today that follows a similar trend? Vaccines and preventable diseases. I believe 50 years from now, we'll be having the same conversation about the safety and effectiveness of vaccines in preventing diseases like the flu or hepatitis A or measles, mumps, and rubella. Why do I think this? Because misinformation spreads on the internet, it spreads through social media, and it spreads through other channels. I think we will be having the exact same conversation in 50 or so years.